We had definition of surgery. We actually took into consideration, discussed many aspects of it, including types of surgery, types of surgical conditions, and even terminology which are used. Now, today we are just going to base our discussion on surgical clerkship. Now, clerkship is just that act of taking clinical history from, biodata, that is the patient particulars, up to the discharge, that is from management. So it entails a lot from biodata, chief complaint, history of presenting illness, past medical and surgical history, and all that we are going to check all through the path up to the discharge. Now we have different clerkship. We have medical clerkship, that is a normal patient who comes into your office just for medical condition. It revolves around internal medicine. It can be parasitic infection, can be just a metabolic condition, can be nutritional condition, can be any possible inquiry that revolves around internal medicine. So apart from that, it's also divided into pediatric clerkship, that is for children, yeah, under the specific age bracket before adolescence actually. So and then it can also be gynecological clerkship or obstetric clerkship that revolves around female mothers, maybe the ones who are already, yeah, the ones who are already been pregnant in a while and delivered, or maybe even if before they got pregnant or maybe delivered. So can be just a young girl or any other woman, and that is now gynecological history. Then you have surgical clerkship. Surgical clerkship revolved around condition, surgical condition. So the condition which involves surgery. So when a patient who had road accident is presenting in your facility, you will actually conduct surgical clerkship. When it is something to do with orthopedic issues, still under surgical clerkship. And you also know that surgical conditions have in facility referral facilities, they're actually located with their own wards. So we have medical wards, surgical wards. So when you're in surgical wards, you do surgical clerkship. So we're going to see on steps in surgical clerkship, assembling all the available fact gathered from particulars, that is biodata, chief complaints, history of presenting illness, and relevant history. Chief complaints is they are just which specific reason that the patient is prompt by to come to your facility. It can be due to maybe fracture, it can be due to dislocation of joint, can be due to many other aspects or maybe conditions. And then history of presenting illness is just this condition or the complaints. Now, when did they start? How have they evolved? What medication has been taken? Any other effect of the condition to the adjacent system? If it is condition to do with, uh, if it is condition to do with gastrointestinal, does it have some relevant effect to the to the respiratory system? So that is that. Mm, Now we are going to also analyze and interpret the examination details to reach the provisional diagnosis. We shall also check and make differential diagnosis, see on how we can make differential diagnosis, order for appropriate investigation, select closest possible diagnosis, and come with effective treatment plan and even discharge. So the general component of clerkship is what we have here: personal particulars like biodata, that is just the name, the age, the next of kin, contact, religion, occupation, residency. All that one revolves around biodata, and you're going to check why we need to actually have them. Then we talk about chief complaints. Chief complaint, just the reason why the patient is visiting or is present in the facility. Okay, so it is something to be very keen with, because chief complaint is what will deduce differential diagnosis, and from the chief complaint is what you'll be keen enough to get your diagnosis, definitive diagnosis. And then if you mistakenly get it wrong on chief complaint, including the entire clerkship will be wrong. If your chief complaint wasn't well labeled, you will diagnose a different condition and you will eventually manage a different condition. So you have to be very keen on chief complaint. And you should also know that chief complaint is always supposed to be placed in the same I mean in the same how will I put this on? Supposed to be placed in the language of the patient. So the chief complaint should be actually written down as it is communicated from the patient. So the patient say that I have a swelling on my abdomen region. That is how it's supposed to be say placed on the writings. You're not supposed to give it a medical or pseudo terms. Should not include hernia when the patient does not talk about hernia. Because the moment you bring in medical terms, you are going to interfere with actually the bestment and you will be biased. So from chief complaint law, a history of presenting illness, review of the system as we proceed. Away from that one, past medical and surgical history will be checked, family history, personal, social, economic history, general examination, vital signs, local examination, other systems examination, provisional diagnosis and investigation, and final diagnosis, treatment plan. Then we are now discharging. So let's start. The first thing when you meet a patient in the facility or in your outpatient, or maybe in the surgical ward, you have to greet the patient by name. It is important to know the patient by name. It can be Snave, it can be Marceline, it can be Njoki, it can be David, any person. So first go and check what's the name of the patient before even the patient comes. Nowadays, I get to see mostly when the patient gets into the facility, the receptionist get on the details and it is included in the health information management system. Nowadays, technology has taken it off in a way that we have interdepartmental facility systems. So this system, they get the name of the and the details already. So when you are checking, you'll just get it on your outpatient computer, get to see who is on the top. That is the patient. So you'll have the name. So when the patient comes in, you'll greet the name. Hello, Elizabeth. How are you today? And then you introduce yourself. I am Dr. Ouma. I'll be the one who will be taking care of you today, or I'll be the one handling your situation today. So whatever you want to say it, as much as it's polite. So you can either shake the patient's hand. There's some culture that do not require shaking of hands, so they'll reject your hand. So you should also be keen. Ensure the patient is comfortable, and then you can start. You can confirm, are you comfortable with the door open, door closed? And then we can start from there. So that is that. And then we talk about personal particulars after introduction. That is the patient name. Why do we get the patient name? You have to give the patient name. It's a psychological benefit. The patient will be like at home, okay? So when you're establishing a rapport with the patient, you need that. And also to record data and maintenance. Like we have referential, we have documentation. All those one requires a name. So some insurance company will come over to check for their patient who maybe is putting a claim to be refunded for the medication bill that they footed. So in such a case, the insurance company normally come with the name of the client. Of course, if you don't record the names, then you'll have a problem. Okay. So the name is very key thing. And funnily, we normally have because Kenya is more of different ethnics, different tribes. Some of the names may challenge you to write. You can tell the patient, give a patient a small piece of paper to write their names. Because if it's a Muslim with a very or a Boran with a very difficult name, you have to spell it correctly. So you'll have to be keen about that. Age. Why do you take the age in particulars? Age related diseases. You have condition which only affect the adults, yeah? Rarely will you find BPH, that is benign prostatic hyperplasia, in the younger age. Rarely will you find Alzheimer and dementia in younger. Bone condition which are degenerative like osteoporosis, osteomyelitis, talking about arthritis, okay, difficulty in mobility and all that will always be just age related condition. So when you're doing your diagnosis, the age will also help for diagnosis, okay? Treatment plan. We have prescription of medication varying from one age to another. An adult will always just get prescription for an adult. A young boy will always get prescription for a young boy. So treatment planning is also a key thing. When talk about sex, why do we want to know whether it's a female or male? Nowadays, we have people who have transplanted. They have done what to call the call it transplanting. Like they have transformed themselves from talk about transsexual, something of sort, changing from male to female, all that. So they do surgery and get everything, including the various glands which support their new gender. So it will be very hard to find a masculine who has developed breast and hips and then think that this is a female is a man, but then that is transsexual. Now, this is the thing. You have to know for sex. Why do we inquire sex? Certain diseases are gender specific. You'll always diagnose endometriosis in female, and you'll always diagnose testicular torsion in male. When it is something to do with the benign prostatic hyperplasia, that is for male. If it's something to do with ovarian syndrome, polycystic, whatever ovarian syndrome, you'll always get it from female. Cervical cancer, female. So that is to certain disease which is actually being suspected because they are diseases which are gender specific. Record maintenance, we need a sex to differentiate male from in our records. Okay, treatment planning, medication for male and medication for female. Some medication are contraindicated in female who are pregnant. Okay, some medication can also be contraindicated in males. They are not supposed to be used in males. Maybe they can hinder spermatogenesis or something to do with that, or suppress the secondary male hormone. So that is that. Now, residence area for future correspondence, we can see adherence, we can reduce the dosage or number of visits if somebody comes from far. So residence, even for follow-up and contact tracing, we can get to know. So we have to know where is the address of the patient. View of socioeconomic status. Somebody who's staying in a low environment, like in poor, like let me say, people who are in Madare and people who are in Runda. That is always a distinction. There's a person from Madare who is at a very low socioeconomic status financially and everything. Somebody else in Runda is very stable. So for socioeconomic status, we'll see even the type of drug we shall check or prescribe because affordability is also something that you always take in criteria of essential medicine. Prevalence and geographical distribution of a condition. Cholera will found in a more of a low socioeconomic status environment where people are not having the clean toilets, the people drainage is poor, congestion, overpopulation. So different diseases can be spread or can exist in different geographical locations. So when you know where you're coming from, for example, malaria is prone in lake bases. Think places to do with Kisumu are very high in malaria than when you check in Nairobi or maybe Machakos or so. So with that, we get to know which are probable diseases and maybe condition which can also be associated with this. Occupation to assess social economic status as well. We need to know where are you working. Are you stable enough to foot the bill of the hospital? Are you stable enough to buy the prescribed medication? Okay, and also occupation is to predict of different diseases in different occupation. Somebody is working in a chemical industry or maybe a lead company, they tend to have or develop respiratory conditions. So if you get to know the exact workplace, the occupation, you'll also be at ease to diagnose or maybe rule in and rule out condition because given these diseases will always just prone in different areas. So that's the case. Snave nitakuchapa hiyo kichwa yako kubwa. Can you just be still? We, napiga kelele. So that is that. And talk about patient's registration number. Talk about religion, belief, and custom that might impact on treatment modalities. There are Muslims who are contraindicated if it comes to some drugs. They don't want to use them. You get to know which drugs their customs do not take in. Okay. Uh, talk about belief. There are some beliefs like I get to realize that Muslims are being they live in a different way. So with that, you get to know so that you don't step on somebody's foot. You get to know what you're supposed to do and with what you're not supposed to do. So with religion, the belief and customs will guide your move so that you don't offend the patient based on their customs and beliefs. Religion as well will help to identify festive periods when religious people are reluctant to undergo treatment and therefore you don't prescribe drugs on those very days. Talk about patient's registration number, still under biodata. This is either OPD number, the outpatient number, or inpatient number for the patient who are actually admitted. So for the outpatient number, uh, you maintain records. You maintain them. Why? If it is a case revolving around accident, or is a case revolving around assault. If it's a police case, the record will be very important for police surgeon. So the OPD number will also be used in the court. So you also need to be very, very keen about the numbers. Billing purposes, the patient registration number will correlate or correspond with the billing. So you have to keep it intact, because if somebody else supposed to finance the billing, they'll always be that analysis. They have to check on which one, how they match. And then medical legal aspect. For what I've told you, terms if it is a police case, even if it is a negligence of duty, and many other things, that registration number will be important in filing. So that is that about today's session. I think that's all that we got for today, and you'll have the exams for this. You can always subscribe in our YouTube channel and follow for many.